Hi, this is Dr. June Phelps from Avenues of Counseling Mediation, and I'm here to talk to you a little bit about teens and sleep deprivation and how sleep deprivation can affect the mental well-being of our teens. So let's just start with a few facts about teens and sleep. Unfortunately, in the United States, most teens are sleep deprived. Typically, a teen between ages 15 and 22 years old needs about 9 hours of sleep to feel well rested. But most teens, about 59 to 70% of teens in the United States, only get about 7 hours of sleep or less. So the facts are that most of our teens are experiencing some form of sleep deprivation. And there are a lot of factors that influence that. One of the main factors is that teens exist in a different time zone than most adults or younger children, in the sense that they have a suppression of their melatonin production. Melatonin is what's considered the sleep hormone. And so they have pressure to fall asleep or a desire to fall asleep later at night. And that's just absolutely normal. So, come 10 or 11 o'clock, when a parent might want their teen to go to sleep, their teen it doesn't feel tired, um, not till, maybe midnight or later. So they're biologically wired to go to bed a little bit later. But that biological predisposition combined with some other factors can lead to sleep deprivation. So, for example, a lot of our teens these days are overscheduled. They have a million extracurricular activities, or they're working a job. And there's a strong sense of that you need to be doing all these activities in order to be competitive for college for some teams. And so that can lead to them staying up later and later trying to squeeze in all the different things that they're trying to do, including their homework, which gets moved later and later in the evening. There's research that shows this increased use of portable electronic devices can interfere with a teen's sleep. Um, that desire to be constantly knowing what's going on and not to miss out. So looking at your social media, but also the blue light that's emitted by portable devices can interfere with sleep. And then bed can be a really strong cue to help teens and adults and children fall asleep, but only if the only thing you're doing is sleeping on your bed rather than using your bed as sort of your home office, doing your homework on it, or your entertainment center. Then bed becomes a much weaker cue for falling asleep. And then another big culprit is just a structural issue, which is that school start times tend to be very, very early. So you combine a teen's biological need to stay up a little bit later and all these other factors that affect how much sleep they tend to get or when they go to bed. And then you combine that with the structural reality that school starts relatively early, and often there are extracurricular activities that occur even before school start times. And you get what's called the perfect storm. And you have teens who are chronically sleep deprived. And some of the general effects of sleep deprivation that the research shows is trouble with regulating emotions. So you see increased irritability sometimes when teens have been chronically not getting enough sleep. They report feeling foggy at school, maybe have some difficulty focusing on their academics. Relationship challenges are often become more intense, partly because of irritability, partly because without regular sleep, there might be more issues with impulsivity and a lack of self-control. So these are some of the general effects that can come along with chronic sleep deprivation. But for those teens who are vulnerable or predisposed to develop some mental health problems, chronic sleep deprivation can be one factor that leads to a more serious mental health condition. And sleep issues are often associated with the variety of mental health conditions you see listed on the PowerPoint slide. So depression, one of the symptoms of depression can be sleep issues, either oversleeping or undersleeping, or a sense of that fogginess during the day. anxiety. Often teens that are experiencing some anxiety have trouble falling asleep. They're often worrying before they fall asleep, or they're overscheduled, etc. Um, when teens experience a trauma, often their sleep is affected. And those who go on to develop a mood disorder called bipolar disorder, one of the symptoms of bipolar disorder is lacking sleep, sleeping very little, but then not feeling tired the following day. And then, of course, there's narcolepsy and insomnia, and those are sleep disorders that are strongly characterized by sleep problems. So, if your teen is experiencing sleep difficulties, is distressed about the sleep, and would like some extra support to help them, or if you feel like that would be useful, please give us a call at Avenues of Counseling and Mediation. This is Dr. June Phelps. We all would be glad to provide you and your teen with some support. Okay, thank you so much. Have a good day.